the first thing is your marginal gingiva. So let me draw a diagram here where I will show you the parts of the gingiva. Okay. Imagine this is your uh, gingiva. Okay. Which color should I choose for your teeth? Supposing this color. Alright. So these are your teeth. Okay. Now this is your gingiva. So there's a free portion of the gingiva, so which is only at the margin. So this is known as free or marginal gingiva. Free or marginal gingiva. Then comes a zone of attached gingiva. So why is it attached? Because it is attached to the underlying bone. Alright. So this is the area of attached portion. Attached gingiva. Okay, and then this dotted line is the mucogingival junction. Why mucogingival junction? Because it attaches the lining mucosa to your attached gingiva. That is why it is a junction. Thus it is the mucogingival junction. Okay, and this will be your alveolar mucosa. Since I don't have space, so mucogingival junction, and this will be the alveolar mucosa. Okay, so here you'll be able to see there will be a frenum pull. This alveolar mucosa is loosely attached. This is the lining mucosa that we were talking about. This is keratinized. Attached gingiva is keratinized. Okay. So coming to the marginal gingiva, it forms the coronal border of the gingiva which surrounds the tooth but is not adherent to it. So in normal tissues it extends approximately 2 millimeters coronal to the cemento-enamel junction. So in your tooth, imagine there's a root, okay, and your cementum and tooth has a junction over here. So we are saying that in normal periodontal tissues it extends approximately 2 millimeters coronal. This direction is coronal direction, okay, towards the, so this direction is apical and this direction is coronal. So it is 2 millimeters coronal to the cemento-enamel junction. Alright, so it is demarcated from the attached gingiva by a shallow depression, okay, and that is known as the free gingival groove. So if this is your attached gingiva and if this is your free marginal gingiva, then this demarcation is going to be a depression, and this depression is known as the free gingival groove. This is the free gingival groove. So basically, it runs parallel to about 0.5 to 1.5 millimeter from the gingival margin. If this is the gingival margin, so approximately 0.5 to 1.5 millimeter parallel to the gingival margin. And why this is the labial portion of the bottom of the gingival sulcus. Okay, now what is the gingival sulcus? So gingival sulcus is a shallow space between the marginal gingiva and the external tooth surface. So let me draw the external tooth surface. This is your root portion. Imagine this is the cross section of the tooth, and this is how your gingiva is getting attached. And this is the alveolar bone. So it is a shallow space between the marginal gingiva, this is your marginal gingiva, and the external tooth surface. Okay, and this is termed as the gingival sulcus. So what are the boundaries of your gingival sulcus? The inner boundary is the tooth surface. This may be your enamel, or it may be your cementum, or both. The outer part will be the sulcular epithelium. This epithelium is the sulcular epithelium, and the base is the margin of the attached tissues. So this is the margin of the attached tissues. The normal depth of the gingival sulcus in absolutely ideal condition, the depth of your gingival sulcus is 0. Zero millimeters. However, there has been seen that the depth of the sulcus is approximately 1.8 millimeters in healthy periodontium, and it can range from 0 to 6 millimeters in healthy periodontium. In general, a sulcular depth of 2 to 3 millimeters is considered normal. Okay, so then what is a pocket? Periodontal pocket. So a pathology, it's the pathological deepening of your gingival sulcus. Pathological deepening, that is when This is your gingival sulcus is going down. So that is when the pocket formation takes place. Beyond 3 millimeters is your pocket. Okay.